Hi, and welcome to Living Connected. I am just delighted for you to meet our guest today, Kathy Driscoll, Chief Nursing Officer at Humana. Kathy, welcome.
Thank you. It's great to be here.
So, Kathy, just as a background, gosh, there are a million podcasts out there, and I never really set out to start a podcast. The whole intention here was as I transverse through this healthcare industry and meet some really fascinating people, really smart people, bright minds with really great ideas and expertise, frankly, that I wanted to be able to share these conversations. And when we met earlier this year at Vive, I had a conversation with you that just kind of resonated with me, and I just wanted to follow up. And I thought it'd be great if we could just record some of this stuff that we're talking about, because I think the world needs to hear about what you're doing with nursing and just what's happening in the industry with nursing care. So thanks for joining.
Happy to be here. Happy to have the conversation too. It's always great to speak with you, Arti.
Thanks, Kathy. So, for the listeners out there, Kathy is not only an amazing leader and obviously has a nursing background, but just a really great person, and fortunate to be able to call her a friend, and probably the coolest grandma I know, Kathy.
Oh, my two little grandsons, Bo and Four, 2 and 4 years old. They're my favorite people in the world.
For the listener, I asked her once, like, which one was her favorite, and she wouldn't answer. I used to, Kathy, during my clinical years, I would have, when I had a patient who was a grandparent and they had multiple grandchildren, I would ask them, like, which one's your favorite? And yeah, like two times out of 10, they would actually tell me, which is always kind of funny, but
I have both of them on my phone, the picture on the face of my phone. So, no telling which one is favorite.
that's right. That's right. So, from a nursing standpoint, there was years ago, and I came from a magnet hospital, Kathy, and what I learned through that experience and leading nurses in my hospital administrative roles, and then going through the magnet process, one thing that I know for sure is that what makes a great hospital is not the doctors. It's actually, you think, oh, well, this hospital has the best doctors. What makes the best hospitals is actually nursing. It's the nurses that actually deliver majority of the care. And I don't think people know that.
I think you're right. If you think about a hospital is staffed 24/7 with nurses, nurses are always there. Nurses are at the bedside. Nurses are coordinating care between many different clinical professions there. And nurses are usually the ones who have that first inkling that something could be wrong.
That's
I
right.
would say also nurses are really good collaborators because it's not just nurses there. There's a lot of other folks, but I think nurses really drive care, quality, experience. And I think that's one of the reasons that Magnet has really focused on how are you involving treating your nurses? What are your nurse experiences? As well as quality outcomes
Yeah.
for Magnet hospitals.
Yeah. And that's not to downplay the work of physicians, but what's a physician in a hospital without, or even in a clinic, right? I mean, and for me personally, I learned from nurses. I went from internal medicine to becoming a wound specialist, and I learned wound care from wound ostomy nurses. So I just have a ton of respect for the field of nursing, and there's so much out there right now with just the plight of nursing. And at the risk of being a Debbie Downer, I do think though that the world needs to understand what the challenges are. I mean, what's your take on the state of nursing in healthcare today?
Yeah, I would say nursing is in a very fragile state right now. It's just this confluence of events. We have an aging population. The aging population is growing and will continue to do so. Our nursing population is aging and will continue to do so. So we have more nurses that are contemplating retirement, near retirement age. And, at the same time, we have a pretty fragile work environment. We have nurses who really have gone through things like a global pandemic. COVID definitely had an impact physically, emotionally. More nurses are burnt out or nearing burnout. We also have a change, and not all these things are bad, but not all care is given in a hospital. So, along with an increasing aging population, fewer nurses, and we have this continuum of care. There's more focus on practice settings outside acute care
Mhm.
hospitals as well. And nurses find some super rewarding careers in places like home health or other post acute types of practice areas, but there's only so many nurses, and we're trying to fill all of these types of roles and the needs in different practice areas. So, I would say it's fragile. It's really an inflection point in many ways for nursing and for healthcare.
Yeah. So what's different about I've worked in every site of service. I joke around and say I've seen patients and have expertise in every site of service except for a penitentiary. Um, but it's what I've seen, Kathy, and I'm glad you brought up home health and post acute, is that the type of patient that is in home health and post acute now compared to what it was 10, 15 years ago is a very different type of patient. They're harder. And I think there was this perception 15, 20 years ago, oh, the hardest work is in the hospital and it's easier here. It's easier or it's less stressful here. I don't know if that's true anymore. It seems like it's just we have a higher complexity population. Folks are getting discharged from the hospital earlier. Like, so when you think about burnout, like, what are the things that are contributing to that? Like, what are the challenges, the most pressing ones right now that face nurses today? And what you would say, like, if you had a loved one going into nursing and you say, okay, I want to give you the reality of what exists today, and here are some of the challenges that you're going to face, like, what are the most pressing ones?
Yeah, first of all, you're absolutely right. No matter the care setting, nurses and all healthcare professionals are dealing with more complex needs. There's a heightened awareness that it's not just physical health that is impacting the health of our society. So, people are in the hospital for a shorter amount of time, stays are very short. There's not a whole lot of, I would say, really fulsome transitioning from whether it's from acute care hospital to long-term care to home to the family without any type of services. And so I think all of those things contribute to a really disjointed, uncoordinated healthcare experience. And as a family member, I think most people, when they or one of their family members is in the healthcare system, that's one of the most frustrating thing. Like, what's the map? How do I navigate this journey? So I think that nurses and other healthcare professionals feel that greatly. Um, the shortage of nurses on any given day, it used to be just the weekends that you would maybe notice that the unit in the hospital isn't staffed as well, or it takes for a little longer for the home health nurse to come out. But it's really 7 days a week now. There's really many states and many associations really are grappling with what are the policy or regulatory types of imperatives around safe staffing. And I think all these factors just really are coming together. And I just go back to we're in a fragile state. Nurses, and again, I would say doctors, therapists, et cetera, probably have the same reasons for going into the healthcare field. Nurses are very connected to purpose and meaning. We go into this profession because we want to help people, we want to improve health, we want to improve access to care and the health of society in general. But there are a lot of challenges right now. So, it's kind of this balance, and we really are challenged to support and take care of our nurses.
Mhm. So this new world of AI, it's everywhere you go, right? AI in
Yeah.
healthcare is such a hot topic. Um, I was recently went through a board review course for internal medicine, and I went into Chat GPT. I was just curious, could Chat GPT answer my board questions, right? And there are clinical, I mean, I've put in clinical questions. How do I do this? And it'll talk me through a procedure, right? And more I see, at least I know, at least in the physician world, we Google stuff sometimes that we don't know. And I'm sure nurses do the same thing. What do you think about the new world of AI and just digital and IT? There are benefits. There are also, I think, some negatives of it. How does it help or hurt this fragile state in nursing? Like, what are some of the good things, and then where do you get concerned about where we're headed with the new horizon in technology?
Well, I was laughing to myself because a few months ago, I asked Chat GPT, how do we solve the nursing shortage?
Oh, what did okay?
So,
What did it
it's
say?
not, it was not a bad answer, but it was very high level. So, offer more flexible schedules, growth and development support, et cetera, et cetera. But it is interesting. And I think because there is such a tremendous amount of information, whether it's clinical information, what do all these initials stand for in something? What are resources in the community? We do rely on Dr. Google there to quite a bit. I think that one of the areas where any type of technology is really helpful is helping to relieve administrative burden. So whether you're a nurse, you're a physician, you're a physical therapist, one of the biggest complaints is around documentation and the burden of documentation, how much time is spent on documentation. So things like speech to text or ambient listening that can help with documentation and appropriate documentation, I think is really helpful. Ways that we can use natural language processing to take large pieces of information like referral. I'm even thinking about that transition of care, hospital to home health or long-term care facility. Um, let's get the information that we need that's relevant, that can help us, but not get the 30-page summary there.
Right.
Um, medication information. So these are all, I think, really necessary and positive technology interventions or ways that we can make sure that we're at least getting closer to working at top of licensure. I know that's always our goal. I don't think it's going to happen tomorrow. I think where we have pause is, are we involving nurses and other clinicians at the beginning of these efforts? I think historically we've all gone through, hey, we're putting a new system in, or we're putting this great, innovation in that's going to make your life so much easier, but we're not asked about it until it's already
Yeah.
installed. And I know we all have examples of that. And out in the healthcare world, all you have to do is read about new systems being installed and some of the problems that very large
Hmm.
institutions or our government is having. So I think that, the concern is getting nurses involved from the beginning to really be able to talk about, what are the barriers to me caring for my patients? Or a leader, what are the barriers to me understanding what the nurses on my team are going through, where they need support, et cetera? And specifically to AI, how do you balance evidence-based practice and clinical judgment? And
Hmm.
how do you not have your clinicians feeling like they're robots
Right.
that don't have any decision making authority? So I think it's like setting up those guardrails that we really need the clinical input from the beginning. We really need all these smart technology companies and really entrepreneurial minds to include on their boards, on their development teams to include clinicians. Otherwise, I think we risk the alienation there. I think the other thing, just that we really need to keep in mind, especially with nursing, is we have such a multi-generational workforce. We have to pay attention if we want the adoption, even of those really good, helpful things. We have to realize that people need different levels of support to be able to use it. And I think we find that when we roll out something that's one size fits all, some people will be the early adopters, will pick up right away. And some people are going to say, no, 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 that doesn't help me. But really, maybe they need a different way of learning, or they need more time, or they need to just provide some input about what would make it be more of a help than a hindrance for them.
Yeah. I liken it to a treatment looking for a disease with some of these new solutions that come out, right? It's
Yeah.
like, hey, look, I created this awesome thing for you. Don't you love it? And clinicians, I talk to physicians about this as well, not just nurses, but it's like, but I can't really use this. It doesn't really meet
Yeah.
my needs. And I think we learned that the hard way through EMR. And now we're learning about some of the, not, I don't want to say the damage, but some of the problems, right, that EMR systems have now created with copy and paste and just not really, honestly, like that the whole point of medical records is communication between clinicians, and we've lost that.
And I think, the other part is we, to a large part, have lost that interaction with our patients because people
Right.
have to be right there in front of the screen that you wheel into a room in a hospital, or the tablet that you have in home health. And, point of care documentation is important. It's accuracy is improved there. But yeah, interaction between both patient and colleagues is something that we need to do better than just filling in the blank because the same question is asked 5 different
Yeah.
times in 5 different places.
Yeah. Yeah. And the name of this series, this podcast, is Living Connected, for many reasons. I think I've told you personally from my own medical journey, and then especially coming out of COVID, I just feel like we're lonely, we're like alienated, we're not connected, and if we can't connect in healthcare, I mean, holy crap. It's like the most sacred thing in
Yeah.
everything we do about healthcare is human connection, right? And something you said about nurses being purpose driven. One of the things that always inspired me about you, Kathy, is that you are a heart leader, you're a purpose driven leader, and you always try to instill that in everything that you did at Humana. How do you think about bringing purpose and joy back for nurses, right? There are these things that we can do for them, but then there's also this mental soul reset we as clinicians have to have. Like, how are you instilling that in the culture of the nurses that you lead and in the organization to better understand the nurses and their needs?
Yeah, I think, the one word that comes to mind is listening. I think that, probably exacerbated by the COVID pandemic. I think nurses have felt, we've lost our voice, or maybe we're talking, but nobody's listening. So it really is important to me, and one of the main areas of focus in our nursing population is opportunities to listen. We do focus groups a lot. We have a shared governance council with representatives from all over the organization. And I try and make sure that there's a mix of frontline nurses, frontline leaders, other leaders. We have opportunities for our nurses to have regular opportunities to dialogue through this shared governance council with our CEO, for example, and to really bring to the table some of the things that are working well that we want to build
Mhm.
on, or where there are barriers to doing what they want to do, which is care for patients and make patients and members have a better, more healthy life. I think the other thing that we're really finding is helps to bring that joy back to practicing is focusing on the ability, not just with our shared governance council, but the ability to network across the organization. We're a national organization. We have a large nursing workforce, over 10,000 people. People tend to get siloed. Maybe I know what's going on in my individual team, but I don't feel like I'm part of something bigger. So we've really tried to have a lot of opportunities for people to learn about what other roles nurses have at the organization, and some of them are direct patient care, and some of them might be in informatics
Mhm.
or quality, or you name it. We have nurses across the organization. And when people are thinking about, okay, what's fulfilling in my career journey, just having that opportunity to connect, to understand what's my place in the organization, how does that impact the larger organization, and that peer-to-peer interaction. We've set up some formal peer recognition programs that are really easy to access. We've set up, opportunities to rotate out of your day-to-day role to somewhere else in the organization. Just that peer-to-peer interaction has helped us to really move the needle on feelings of engagement, belonging, that I have a place here, and this is my place, and I feel I belong here. I feel I have respect from my colleagues and leaders, etc. So I think the answer is it's not one thing, but it's a lot of things, but they all go to feeling I belong. I feel connected to my purpose.
Yeah.
And I like being a nurse, and I like being a
Yeah.
nurse here.
Yeah. The key word being belong. I think belonging
Hmm.
is like the, yeah,
Hmm.
for sure. So last year you made me think, Kathy, about, I had two different chemotherapy infusion experiences. I had one where the nurse and her manager were clearly they had a conflict and she wasn't in a good mood. And it was chemo number 4 or something like that. And I remember just having it was just, it didn't feel good as a patient. And then there was one where the nurse and the staff were just so cheerful and it made such a big difference. Like, they put a crown, and obviously I had no hair, so it hurt, so I had to take the crown off. But they brought me a crown and said, "You're queen for the day," and they were just making jokes, and I just felt it was a different experience. It carried with me for days, both of them. One in a negative way and one in a positive way. And if you recall, there was that ad, right? It was like happy cows make good cheese, or I forget what it was. But I'm a profound believer that I think, and it's not just for clinicians or nurses, I think it's in everything that we do, right? When you have joy and you're in a good headspace, you just do better work, right? And from a leadership standpoint, I'm going to go back to just the type of leader you are. How how do you coach and inspire nursing leaders to create that culture of joy and happiness, because it does translate, and I can tell you personally from a patient experience, it's night and day, the type of environment. You can just feel the energy when you walk in, whether it's a physician office or an outpatient department. I can tell the mood of a clinic based on that.
Yeah, no, I couldn't agree with you more. I think that overarching, if we don't take care of our nurses, they can't take care of their patients, their
Right.
members. So we really do need to focus on that. And as you see in many areas of healthcare, we often see that really good clinicians get promoted into leadership positions without having the chance to develop and have supported the development of leadership skills. So,
Right.
you know, guiding people through change, having, difficult conversations, focusing not just on production type work, but the experience that your team is having, team building, you name it. So one of the things that we really have focused on in the last few years too is specific leadership development initiatives. But I think we have five different stages, from people who are just thinking about being leaders to executive presence and leaders, and really focusing it at clinicians. We're a large organization. We have lots of resources, but they weren't all focused at the unique needs of clinicians who, maybe you're a home health nurse and you're going out into some difficult environments, family dynamics, a limited time to accomplish certain things. And, how is your leader going to support you so that you can do your best work too? So, I think that that's crucial. One, helping people to develop those skills, and two, understanding the business of healthcare. And I think that's also crucial for leaders. And that doesn't diminish joy or anything like that. It gives you the context that we need, in order for a business to be scalable, sustainable, etc. This is where we need to get to. No one person is going to do it alone. Here's where teams come in, and here's where helping to develop leadership skills that enable teams that are connected, that feel they belong, that have that joy in work, can produce really high quality, good patient outcomes as well. So that is one of our priorities, is really the different levels of leadership development, because I see it time and again. And it's a way that you're going to burn out really good clinicians that you don't give support to. And that negativity can flow through a team just as well as
Yeah.
positivity.
Yeah. We see that. I mean, it happens in the physician world too, right? You take physicians and you say, "Hey, this guy's doing great. Let's put him in a leadership role." And I saw this in the hospital setting, and then
Yeah.
they haven't had leadership development. So the ability to actually talk up, right, up the channel and be able to have conversations with non-clinicians, but then also be able to lead and inspire,
Mhm.
it's tricky. And
It
I think
is.
people underestimate how hard it is, because you do end up, I know for me, like I have my brain compartmentalized. It's like, okay, I need to shift to this way of communicating and thinking, and then another, depending on the scenario, and knowing which one to flex it takes time.
It does. It does. And, that's one of the things that we thought about early on too, is just our communication strategy and
Mhm.
messaging. We could get the same ideas across, but you're not going to message or communicate in the same way with, a community of nurses as actuaries and accountants. Doesn't mean that one's good, bad, or
Right.
otherwise, but it's just, kind of get to where things are meaningful. And with nurses, that tends to be, how does this impact patient outcome? How, can I make my life easier, so I have more time to impact the patient outcome? And how connected am I to my purpose and meaning?
Right. But that conversation might be different if you're talking to somebody in actuarial
Hmm.
science,
Yep,
right? Their WIFM
absolutely.
is different. And I think you have to change the language for
Yep.
sure. So thank you, Kathy. So here's how we're going to end. I told you why we called it Living Connected, the podcast. Who is someone, uh, professionally or personally in your life, that you feel like you have always stayed connected to, that has inspired you, developed you, anchored you? Can you think of a single person?
Yeah, I'm gonna shout out a former colleague of mine here, Tim Duke, who was an HR partner.
Yes.
I came to Humana in 2012, worked with him since then. And, people always say, you need your personal board of directors, and one of those people should be somebody who's always going to tell it like it is.
Yeah.
And Tim Duke was always a great support. He had been at the organization for a long time, so he could navigate things and everything, but he always told it straight to me. And sometimes people tell you what they want you to what they think you want to hear. We all have blind spots in what's going well and where we could do better and what we still need to learn. And he's someone that I've stayed in touch with even after he retired. We actually just had him come. We had a summit for our Nurse Advisory Council and our Social Service Advisory Council, and he came there, and it was just so gratifying to actually be able to share him with a broader group, even in his retirement. So kudos to Tim Duke. He's always been
Yeah.
one of my people.
So I only worked with him, I think he retired 3 months into my role and he had retired. And I remember when he said, listen, anytime you need to bounce something off, please text me. And I used to actually
Mm-hmm.
reach out to him. He was amazing. And you're right. He was a straight shooter, but he had this like gift of doing it with love and kindness. Like it didn't hurt as much. It always felt like even if the feedback wasn't what you wanted to hear, it always built you up
Yep. Yeah,
instead of making you
absolutely.
feel awful. And I think that's a gift. Not everybody has that.
Absolutely. Absolutely.
Awesome. Well, thank you, Kathy, for joining. Really appreciate it. And thanks for telling. I mean, I learn a lot every time I talk to you. So I appreciate you being on.
Thanks, Arti.